Hi, everyone. Welcome to our second installment of Pass the Baton, resident to resident advice for excelling during internship. On behalf of the Latino Surgical Society and the founding members, it is a great pleasure to welcome you for tonight's session. We want to share a little bit of information about the Latino Surgical Society. We were established to cultivate, nurture, and support the advancement of Latino surgeons. We hope that you can connect with us and look to our website, look for us on social media, on YouTube, on Instagram, LinkedIn, Facebook, and Twitter. We really want to continue to engage and grow the organization, find ways in which we can support you. So please get engaged and help us move forward together. We want to also acknowledge our institutional members, including the University of Washington, Seattle, Emory University School of Medicine, the Department of Surgery, the University of California, San Francisco, the University of Texas at Austin, Massachusetts General Hospital, Morehouse School of Medicine, the University of Alabama at Birmingham, Oregon Health Sciences University, Harbor UCLA Medical Center, the Penn State Department of Surgery, Houston Methodist Hospital, and Penn State Health Hershey Medical Center. If you'd like more information about how your organization can become an institutional member, you can also visit our website, www.latinosurgicalsociety.org. Tonight, we have a stellar lineup for the Pass the Baton event, and it is my distinct honor and pleasure to introduce to you our moderators, Dr. Breanna Dominguez and Dr. Rodrigo Alteiro. Dr. Alteiro is an incoming surgery resident at UT Southwestern Medical Center in Dallas, Texas. He also completed a 2-year postdoc research fellowship there, during which he focused on health services research and healthcare cost analysis. He studied racial and ethnic disparities in the field of gastrointestinal cancer and hepatobiliary surgery. He's passionate about surgical education and has a particular interest in curriculum development, simulation, and surgical video assessment. He was born and raised in Caracas, Venezuela, and aims to become an academic surgical oncologist. Welcome, Dr. Alteiro.
Thank you.
Dr. Breanna Dominguez is an incoming general surgery intern at Wright State University in Dayton, Ohio. She also attended medical school there, where she obtained a master's in anatomy. She's currently interested in trauma and critical care and is passionate about medical education, mentorship, and improving representation and equity in surgery. We're very happy to have you. Welcome, Dr. Dominguez.
Thank you.
Thank you, Dr. Romero. So welcome to our second edition of Pass the Baton, a Latino Surgical Society event geared towards surgical trainees. During this event, we'll hear from current Latin surgical residents who are in their second year of training at various programs across the nation about their internship experience and how they excel during their first year as surgeons in training. We hope that current and prospective surgical interns benefit from the wisdom pearls that will be shared by today's outstanding speakers.
On this panel, we're honored to have Dr. Gracia Vargas as a general surgery resident at the University of Pennsylvania. She's interested in both transplant and pediatric surgery and hopes to pursue health services research focusing on disparities in surgical care, access, and outcomes. She's a proud graduate of the University of Michigan Medical School, where she is an active member of LMSA, including serving as co-director of LMSA Midwest from 2019 to 2021.
We have also Dr. Sophia Williams, who is a surgery resident at Baylor College of Medicine in Houston, Texas. She graduated from the University of Iowa Roy J. and Lucille A. Carver College in Medicine in 2021, and is currently an intern on the 7-year research track at Baylor, while also being a lieutenant in the United States Navy. She's interested in surgical oncology, medical education, military medicine, and mentorship, and sponsorship of those underrepresented in surgery and in the medical field. Welcome, Dr. Sophia.
We have Dr. Heide Malave as a first-year general surgery resident at University of Washington. She's originally from Newark, New Jersey. She graduated from Stanford University, where she studied biomechanical engineering and went to medical school at Columbia University. She's passionate about providing patient-centered healthcare and advocating for those historically underserved in medicine. She loves trying new things and exploring new places and enjoys hanging out with friends, her husband, dog, and plants. She's interested in colorectal surgery, acute care surgery, and trauma. Welcome.
And finally, Dr. Sebastian Shu is a Chinese Peruvian and general surgery resident at UT Southwestern, Dallas, Texas, soon to transfer in the University of Missouri, Kansas City. He graduated from the University of Peruana Cayetano Heredia in Lima, Peru, and he's passionate about improving surgical outcomes in underserved populations. He completed a research fellowship at the Program on Global Surgery and Social Change at Harvard Medical School and has been involved in multiple collaborative surgical research projects. Welcome, Dr. Shu. All right, so first of all, I want to thank every panelist again for your time to be here providing some words of wisdom for this upcoming year. And I think that every one of our experiences are in great part shaped by our own expectations. In the next questions, we are going to explore just that. So as a first question, before starting residency, what were your expectations about intern year? And what scared you the most, made you more anxious or nervous about this year?
I can probably go first. I think the first expectations of the intern year was that obviously there was expectation of long days and very demanding hours. And I think that I honestly had the expectation that I needed to be the best problem solver. And it's part of the most scary part that I had at the beginning. You know, it's just the expectation that you need to solve every single problem in the floor, in the consults, in the ED, and sometimes you don't have the right answer, and that's absolutely fine. I think it's important to recognize that from the beginning, that you're working with a team, and sometimes you don't know the right answer, and it's okay to ask for help.
I think in a similar vein, I was anxious about not knowing all the answers, which I think you will quickly learn that in surgery, there will, like, no matter where you are in your career, there will always be questions that you don't know the answer to. And so you will learn to be somewhat more comfortable being uncomfortable. But I think kind of a corollary to that kind of mindset was in medical school, everything is about evaluation. Like, you're constantly being watched and evaluated, and everything is about your grade. And when you start residency, or when I started residency, I was like in that mindset. I was like, everyone is going to be judging every single thing that I do and don't do. And while I do think that, you know, and we can get to this point later, I do think that the impressions that you make at the beginning of your year will stick, and they're very, very important. I think the objective is different. You're not there to be graded. You're there to learn, and you're there to provide patient care, and you're there to be a teammate. And as long as those priorities are the way that, you know, that they should be, people will have your back. And like Sebastian was saying, like, it is a team sport, and it's okay, you know, to not be perfect all the time. And I think that that was a good kind of change in mentality that, you know, I was able to kind of learn over the course of the year.
We'll do the next question now. From others' experiences talking while I was applying, I know this is a really hard year with lots of new experiences and lots of learning. What was the steepest part of the learning curve, and how did you overcome that?
I can talk a little bit about this. I think for me, and maybe for most of you, you are, as an intern, you're kind of in charge of the floor. And that has so many moving parts that I think even as a medical student, especially I think some of us experienced the limited clinical experience for COVID. And so I think that was all a new experience of handling multiple tasks and sort of triaging things, and then also having a system for making sure you're doing the things. And so for me, I think it was helpful to actually reach out to and have mentors. I didn't realize how helpful that would be. I think someone once told me, like, Haiti, why are you trying to reinvent the wheel? And that really struck me. I was like, oh, that's so true. I don't know. I just felt like I needed to do everything and figure things out on my own, but you're not the first intern. Someone else has been in those shoes. People have a lot of wisdom to share. And I think that's sort of how I started developing a method to literally the madness. And people shared their sort of organization skills and task management skills. And that was really helpful.
I think one of the other biggest learning curves was realizing your different role as going from a student to an actual like patient care provider, and that now you might not wait for people to say like, oh, you could help out with this, or oh, you could be that. So I think going from like, we all tried to be really proactive as students, because like I feel like we also self-select for those personalities in surgery, but being even more proactive as an intern and not quite as reactive like you can step back into as a student was one of the hardest things for me. Trying to like anticipate what they would need help with, or anticipate how I could be a better member of the team, outside of just the clinical knowledge that was like a huge enough slope to begin with. Was just trying to figure out like what a role as an intern was like.
And I think on that note as well, I think I sort of was in that mode where like I can't make decisions. I am the intern, but really realizing that you're an integral team member, you have a different role. It's not like a lesser role, and you really have different responsibilities. And so you have to sort of be independent and proactive in those responsibilities.
Sure. Thank you for those insights. Those are really helpful. And this is a question for each one of you, I guess. You can take turns, but looking back to this intern year, what is the most important lesson learned from internship? If you have to choose one, what is it? You can go first, Sophia. I see you thinking there.
I know, I'm still like trying to think. But the first thing I thought of was a quote by Maya Angelou that we saw on one of our grand rounds. It was along the lines of, people won't always remember what you did, but they'll remember the way you made them feel. And I felt like that one is really true for interns. We're on quite often, like I feel like at places, we're on really short rotations. We're constantly with people both in our specialty and in the surgical subspecialties. And so there's so many people we're interacting with during that first year that it's, I would say, I mean, I haven't done the rest of residency yet, but arguably one of the most critical times for forming connections with people across the hospital. And like, that's not just within your residents, but it's with nursing staff, circulators, like the people that you'll rely on for the rest of the 5 to 7 years. And that's, I think, once somebody had emphasized that to me, I think it totally like shifted my mindset, especially on those days when you're so tired that you like barely even know your own name or not even oriented yourself anymore. But just knowing that each and every interaction you have with people, like it matters and people will remember, and it can totally make or break not only your day, but other people's days too.
What about you, Gracia?
I really like what you said, Sophia. I think I'll come up with a different point just so I don't repeat yours, but one of our chief residents, you know, we were having a resident only meeting, kind of debriefing the year so far. And he said, I think like the best interns are the ones who like are humble enough to say that nothing is beneath them. You know, like if a patient asks you to go get a glass of cold water, unless you're like truly have something you have to do right now, like do that. Like you're gonna have one more thing to do, but it's so worth it. So I'm really glad that you brought that up, Sophia. I would say the other thing, you know, that the other piece of advice that I'll claim is know your patients better than anyone else. And that is a hard thing to do. It's going to be hard. You're not going to be there for the first day of the year. But I will like challenge you every day to aim for that. And at some point over the course of the year, you will be that. You will be the person who the attending knows, like, you know, your patient's labs, you have seen their x-ray, you know what their belly feels like this morning, you own your patients. And that, I think, is like a really important way to grow and like learn how to manage people clinically as an intern. I also think that comes hand in hand with like being people's doctor in the humanistic way. Like your patients should know you and your name, and they should recognize you when you come in the room. And I think if you aim for that, by the end of the year, you will have grown, in a holistic way towards who you hopefully will be as a surgeon.
Haiti, I saw you unmuting your mic. I'm sorry. You go next.
No worries. I feel like I agree with everything you guys have said. And I think maybe we're going to talk about this at some point. But for me, I really had the whole imposter syndrome was so real for me. And I think how that presented itself was kind of being a shell of who you are and not feeling like you could show your personality. And I think towards the end of intern year, I kind of got out of that shell. And that was the best thing I did, because it does allow you to sort of form those relationships that are so necessary when you're in such a team centered environment. I was able to, chat with the nurses more freely, chat with my own patients more freely. I got outside of the fact like, oh, I'm just doing tasks. I'm just, I'm just the intern, and actually just like being a regular human being and being yourself is actually, it helps you, and it helps make you feel better. And it actually helps everyone around you feel better too.
Last but not least, Dr. Shu.
For me, I think the most important lesson of this year is learn how to prioritize tasks. I think, and these involves everything, from personal life, how to find and be acknowledged, if you feel super stressed and you have worked so hard for this week, you deserve some time, you need to prioritize that time for you sometimes. And also you need to learn when to prioritize tasks for the patients, right? What is a priority? You will have multiple situations in which multiple things will come in conflict. Like, for example, like patients who need to go to the OR, or patients who need immediate consent, or even if you are reapplying, you need to fill out your application. So there's gonna be situations in the year that you need to learn how to prioritize tasks, what is important in that moment, and think this year helps a lot.
Kind of a different vein of questions. So we all know that switching from med student to doctor is a challenging transition. Even just switching from introducing yourself that way has been difficult for me. There's lots of new experiences and responsibilities, and now patients rely on us, and we have actual responsibility, and there's fewer people above us double checking everything we do, and we can sign orders and notes on our own now. And that makes me want to be as prepared as possible to give my patients the best care they can get. So do I need to study before I start intern year? I've been very worried about this. I start on surgical ICU, and I'm kind of freaking out the closer it gets. Do I need to study?
I'm going to say, I think, so a lot of people told me that studying would be kind of futile. And I think at this point, I kind of agree with that. I think, you know so many things that you learned in medical school. And truthfully, like the time that you have right now is time to sleep and get moved in and like, find where the nearest Costco is and get to know your co-interns. And I think the best thing you can do for yourself to prepare is just kind of think about just reflect on like, what are my strengths and weaknesses? Like, I know, for example, that when I am struggling, I tend to like retreat into myself, and I don't call my family, and I don't call my friends, and I don't talk to anyone because I don't want anyone to know that I'm struggling. So like, I think take this time to just reflect. Like, you've learned so much about yourself as like a human over the last however many years. And I think like mentally prepare yourself for what is coming. And I think the academic preparedness you've like put in the legwork. Like, I think that will come with time. I think on a very practical note, something that some of our senior residents helped us with before we started the year was setting up we have Epic here, but you know, whatever your electronic medical record is at your campus, like setting it up, like there is a way to set it up so you can minimize the number of clicks you need to do when you're pre-rounding in the morning. There are some like very practical things that don't require a lot of brain time that do kind of like help make you a little bit more efficient when you start. If you really want to do something, you could probably text one of your older residents and be like, hey, can you help me set up Epic one of these days before we start? But truthfully, I'm of the opinion that it's not really worth kind of sitting down and like pouring through a textbook before you start your first rotation. Everyone started kind of in the same place, and so, you know, people will be you know, expecting to teach you, and that's okay.
Anyone?
I think it does. Oh yeah, I think it does depend on your like comfort and level of experience. So I know for me, I was really freaked out because I felt like I had such limited clinical experience, and there were a few books that were recommended, and they're kind of like books geared for interns, and they usually center around like really common calls that you'll get as an intern, like for floor patients. So I thought that was pretty helpful actually, and there's like really short versions of that, and so like, you know, what happens if you get called for a patient who has like a rapid heart rate? You're like, oh, okay, I can like kind of go through my little to-do list of like things I should order, things I should do. And that kind of took a little bit of the edge off of like what could happen during intern year. So that was helpful for me.
Yes, definitely moments of a lot of anxiety. And as previously mentioned by Bree, this year, again, is a challenging transition, and it can be and have emotional tolls on interns in addition to the physical toll from a heavy workload. So based on this, can you tell us one of your highest and one of your lowest moments during internship?
Yeah, I think there's so many. I think intern years like that. You have so many highs, so many lows, and but I remember this one. Like the best, one of the best highs I had was actually firing the GI stapler for the first time in the OR, and it was in the pancreas. It was because I showed up, I finished my task on the floor, and you know, I asked the attending, hey, can I scrub in? Can I just see closer? And he was so grateful, so nice to invite me to fire the stapler. That was definitely a high. A low, I think it was the first night call. That was rough. I come from an international medical school, and we weren't trained with electronic medical records. So imagine starting intern year, trying to learn Epic and trying to figure out where to put the clicks, and you're the first call for the night shift. So I think that was very rough. That was a very steep learning curve, but you are not alone. You are always with people who can teach you, either your co-residents and other professionals, right?
Those are great. Yeah, you're right. This is a roller coaster of emotions. That's what I've been told. Bree, you want to go with the next one?
So speaking of big emotions, I'm sure all of us have experienced imposter syndrome. What was a time that you struggled with that as an intern, and how did you get through it?
So I'll give an example that might be relevant for right now for everyone who's listening. I had, and I think that this is like particularly pertinent because we all interviewed virtually, which is so bizarre. And like many of us are on Twitter, and Twitter is this weird space where like it's kind of like the Instagram of medicine, and everyone shows their best face. I cannot tell you guys how intimidated I was that I matched with my co-residents because I knew them all from Twitter, and I was like, these people are so much more impressive than I am. It must be a mistake that I'm here. And I was truly convinced of that. Like I really, really thought that I was here on accident. And I think like, so this is where you guys are at, right? Like you don't know these people really other than their social media, and you're all new. And I think that just, you know, over time, and part of the challenge, I think, in overcoming this, at least when you look at your co-interns, is like at least here, like there isn't really redundancy. I never actually get to work with another intern because there's only one intern per team. So you have this image in your mind of like everyone is reading papers and they all know like they're going to nail their ABSCITE, and they, everyone knows like whatever the criteria are for like the breast, whatever cancer stages, like everyone knows everything and I don't know it. And I think over the course of the year, like you realize in having conversations with each other and sharing and like being vulnerable with each other about your struggles that you really kind of are at the same place. And I found, that we would sign out to each other. So we have like a day float, night float system. And so every day at 6 a.m. and 6 p.m. is kind of where like all the interns get together to sign out. And I pretty much on a daily basis kind of stay kind of late because I like talking to people. But that is where you break the imposter syndrome down. Like that is, and I encourage you to like be courageous and like share and say like, today was horrible, like this happened, or I made this mistake, or I feel like, my chief resident was upset that I missed this, or whatever it was, like share. I think that sharing encourages other people to share. And that's where not only do you build a strong bond with your co-residents, but also you realize that you're not as different as you think that you are.
Sophia, any experience that you can share about imposter syndrome?
I totally agree with you, Gracia. Like I definitely came in having seen stuff about my co-residents, and I was like, what in the hell? Like this doesn't even make sense. Like I can't believe that I matched. And I still do kind of feel that imposter syndrome throughout the rest of intern year from the stuff I see on social media. Like I think one of the biggest things that's been hard this year is feeling like even if I am learning day to day, that I'm either A, not studying enough when I get home, or like B, that even if I am studying, I'm not also trying to like do research or do all of these other things or do something that's cool and wellness that I could put on a fellowship application and all of this, which then when I like sit myself back, I realize it's just bizarre because like it's just year one and you're just trying to like literally get a foothold here, which I think is like one of the biggest things you could do in intern years, just find your foothold and like make sure that your like shirt is on your top and pants are on your bottom. But it's just the stuff that you see throughout the day, like it always looks like everybody else is doing better than you are. But you'll know you've met your people, like when you can start sharing some of that and like having those honest and vulnerable moments, because it really humanizes your experience through arguably one of the hardest times that you'll probably have to go through in your life.
Yeah, absolutely. So I do want to hear Sebastian's opinion, just because I come from an international medical school too. It's difficult. We come from a different system. Definitely, imposter syndrome hits hard and it's real. And I want your opinion, Sebastian. How do you felt in the first year of residency? Or can you share any experience where you felt that imposter syndrome was there?
I mean, honestly, I don't think I'm the right person because, I don't think I overcome it. I think it's a thing that always happens because there's always someone who is a little bit better than you in something, right? So I think it's the key is to have the right mindset in being proud of who you are, and be proud of what you know. And that's it. I think it's just trying your best and be proud of who you are.
Thank you. Thank you for that. Okay, so talking about emotions. So I know that having a support network is essential to being emotionally able to handle the work of a doctor, but can be very difficult for people moving to brand new areas. So Haiti, what advice do you have for interns starting in new city and or state?
Ooh, this is a good one. So the summer to start intern year, summer is nice because I think you have a little bit of vibrancy from, I think, whatever city you're in, and probably the most vibrancy for any city. And I can say that about Seattle because it can be kind of gloomy and dreary and rainy. So the way that I this is my method of exploring new cities. I tend to like coffee shops or donut places. So I would always just find a donut spot in a new area and then tell myself that was my task for the day, get to the shop, explore, and then come back. And then also I tried as much as possible to just say yes to when people invited me places. And that just kind of got me out and about. Yeah, and then I also just enjoy taking, if your city or area has public transit, I just try to explore that as much as possible as well. Yeah, it's like when in Rome. So I tried to do that. Like I'm not really an outdoorsy person, but I got my first pair of hiking boots. I got a bike. So that was fun. And I would say do it now, because I'm glad I did some of those things in the very beginning, because it can get a little more hectic and it's harder to sort of plan those things out later.
This is not something I would recommend, but I was kind of homeless the first 2 months of intern year. My housing fell through the day I was driving to Philadelphia from Michigan. So I literally landed in an Airbnb. Again, would not recommend, but if you find yourself in this situation, there is hope. The silver lining to this whole situation was that I was already in Philly when I was trying to find an apartment to rent. And so that was it was a great impetus to get to know a bunch of neighborhoods, because most people just land right by the hospital and that's it. And since I was here, I was like, what the heck, I should explore. And so I kind of did what you did, Heidi. I on a whatever weekend day I had off to see 6 different apartments. I'd be like, okay, well, I'm going to get coffee here, and I'm going to, go to this grocery. Oh, there's a Trader Joe's here, whatever it happens to be. And kind of make that your way of exploring. I really like running as a way to get to know neighborhoods. And I guess it's kind of similar to the public transport, where you just kind of are taking paths that maybe you wouldn't take if you were driving yourself everywhere. But I do want to emphasize, because that was a very dark time in my life where I didn't have a home address and I was applying for medical licenses with an Airbnb address. If you find yourself this year in a situation that is just feels unstable, because it is unstable, ask for help. I think that we all are the kind of people who really struggle to ask for help. And I cannot emphasize enough, every person, by nature of being the new interns, you are already so loved by your program. I cannot emphasize that enough. And people will want to help you, even if you feel like a stranger. They've been looking at your face on their wall for 4 months. They're so excited to meet you and help you in any way. So don't be afraid to ask for help.
These next couple questions are probably best suited for our residents in Texas, because they're about caring for the Latino population. And I know for a fact the University of Pennsylvania does not have a very high Latino population, but anybody can chime in. So Dayton surprisingly does have a fairly large Latino population, and I've gotten to take care of some patients who only speak Spanish. And those are some of my favorite interactions, because just my last name makes them more comfortable when I walk in the room. So if you do get to care for Latino patients and Spanish-speaking patients, what has that experience been like, and how does your identity shape your experience as a doctor?
So, well, here in Dallas, we have 2 main hospitals. One is Clements and the other one is Parkland. Parkland has probably 50-60% Hispanic population. And for me, my experience was you always get that sensation of relief when you start speaking Spanish and the patient only speaks Spanish. And in my case was an interesting surprise. They do not expect me to speak Spanish because they see me as Asian. And it's a quite interesting reaction. It's wait, what? And I always get that the look in the patient's eyes when they feel that relief, and it's so gratifying. It's really a unique experience in which you are a source for them to release some pain or whatever. So I think being acknowledged that moment helps you also to keep doing your day activities. Sometimes we fall into the routine and so many things to do in the day, but reminding ourselves about those situations really push ourselves to do better each day.
Haiti, you go. I saw you on mute first.
Okay. So here at University of Washington, there are 5 major states that we take patients from, but there are also, so people come from around all of Washington as well. And I also get that census of people are like, wait, how do you speak Spanish? I'm Dominican and Puerto Rican. So that I didn't get that as much on the East Coast, but I get that a lot more on the West Coast. But I think, I would say it's not a large population, but there are Spanish speaking patients. And I think there's less familiarity with Spanish speaking patients and Hispanic culture. And so I do feel like I get to be an advocate for patients. And you also get to bring, you shouldn't really be used as an interpreter. I think we can talk about that later. But I think I always try to take charge when I speak Spanish. I'm like, I will be speaking to the patient. I won't be your interpreter. So you can tell me what you would like to talk about, but it's not going to be a sentence by sentence interpretation. And I think that gives me more ownership. And then also just ends up being me having a relationship with the patient versus me being like a functional interpreter. So yeah, I think you get to be an advocate for your patient medically, and then you also get to sort of have more of a bond, and I think really enrich their experience.
I can kind of speak on the opposite side. So unfortunately, I grew up as a no Sabo kid. Like I didn't grow up in a Spanish speaking home, but we still like had a lot of the cultural aspects and things like that. I just don't speak the language well. But that being said, for the majority of people in my program, I do speak it better. So it's exactly like everybody else has said, just even being able to ask a patient just how they feel in general and like about some of the simple stuff, like you'll see like them tense up less. And especially we have a very large safety net hospital here in Houston, who's primarily probably 65 to 70% Hispanic, Latino, and Spanish speaking. And so it's a huge part. And fortunately, we do have very good resources here, being this far south and in Houston. We have tons of like in-person interpreters, as well as an easy dial out that they give all of the residents so that you can call directly on your phone if you need an interpreter. So it's unlike anything obviously I ever experienced in Iowa. So it's incredibly refreshing to have the resources match the actual community that it does exist down here.
I'll add something brief. I think these experiences working with the Latino population that we come from and is like close to our home and to our hearts is like, particularly special. I think that another thing that we bring to the table is that level of caring a little bit more than other people do. Like you bring that to every patient encounter. And I'll say there's one kind of community hospital in downtown Philly where we rotate, where I've had like more, immigrant Latinos that I've worked with there than anywhere else, but also like every single day on rounds, we would have to call an interpreter at least 3 times. And every time it's a different language, Russian interpreter, Ukrainian, like everything. And you bring that same level of caring to every patient encounter. And it doesn't matter if it's someone that you don't speak the language with, like you're going to care a little bit extra, and you are going to have the interpreter on speed dial on your phone when no one else in your team does, because you know what impact you can have with that little bit of extra effort. And I would encourage you to keep that, because it makes a big difference for our patients.
All right, so thank you for your answers, guys. Okay, so moving to another section that I think that it's important, and we're short on time, so let's just jump through this one. Okay, so we know that organization of time is essential to be successful in the field of medicine, and I believe that wellness must be an essential aspect of the surgeon's daily routine and of any high-performing professional actually. So to be to reduce and prevent burnout, of course. So now studying for the app side is also important. So ultimately, there's a limited factor, which is time. So what are your tips for time management as an intern, and how did you organize your time overall?
There are a few tips for that. I think, for example, some people do well doing a lot of questions, and most of the programs provide access to TrueLearn, for example. And there's an app for TrueLearn, and if you have any like free time, you're imagine on call and you're not doing too much, you can pull up your phone and start doing questions, and you don't have to have like full laptop or log in. It's just in your palm of your hand. I think that's a very specific and quick way to keep studying.
I think for me, something I struggled with is like breadth versus depth. And there's so many topics, and I was like, I'm gonna read this entire Sebastian's chapter. Okay, that never happened. So I think just know that, and I think this is gonna come up, but like for the app site, like breadth is important. Like just know a little bit about everything, and also like just adjust to your learning style. Like don't try to be somebody else. Like if you know you're not going to get through this chapter, like stop, just read a smaller excerpt somewhere else, like do short questions, like do what works for you. Don't compare yourself to anybody.
I don't know how much I retained, but I would listen to the Behind the Knife podcast in the car because I drive to work. So I would listen to that in the car or like on a run, which admittedly I run a lot slower when I'm not listening to music, but like it was useful, I would like Heidi said, it's a lot of it is breadth. The other thing about TrueLearn is try like don't study the way that you study for like one of the step exams where you're like, I need to pore over this with like every detail, at least not right now. Just get through the questions. The reason why I say that is eventually you're going to notice that there are certain questions that they just like asking. Like they're going to ask you about enterocytes and like what kind of molecule they're fueled by. Like there is always a question about that. There's always going to be a question about melanoma, like what's the cutoff, like 0.8 centimeters. But you're only going to know that if you get through enough questions. So just plow through them. Like it's okay. Just get the numbers in. And like we have like 5 to 7 years to figure this thing out. So like just try your best, and like Heidi said, if something isn't working, just like drop it and try something else. It's not worth like killing yourself over this year.
So with all of the free time you have, how do you take care of wellness and squeezing that in the, 30 minutes a day you maybe have? And if you have families, how do they factor into your schedule?
I think I put this in the like Q&A, but it finally took me forever to realize like your significant other, if they're not in medicine, probably has more time than you do. So I think having frank conversations about like what you can and cannot do and setting some of those expectations, like I need to study when I come home, like don't talk to me. But also like here's my schedule and here are the days that I have off. And yes, maybe it's a Wednesday, but at least they know in preparation and you can share that time. And I think just making the most of your time.
I mean, I think this is a struggle since undergrad, but like every week I have the same conversation with my mom that like sometimes I don't have time to talk to her as much as she wants to. And I think this is a distinctly Latino thing, and it's an ongoing conversation, but I just want everyone to know that like there is solidarity and we're all there with you. And sometimes you have like difficult conversations about that, but they still love you and support you. It's just they like time.
My mom literally called me in clinic today. I was like, Mom, I am working. Yep, still working. Yep.
All right, guys, we can move to some questions that we have from our audience. So here's a question, and it's regarding on how to manage difficult team dynamics, especially with upper level residents, and how to cope with those situations. Can you comment about that?
I can mention that, for example, here at UT, I mean, we have a very large program. There's more in all 5 years, there are more than 100 residents. So it's inevitable to find or encounter different personalities. And you have to also acknowledge that not only is going to be your co-residents, it's going to be also the residents or fellows or attendings or people who already is in the hospital for years, and you're going to encounter different personalities. I think the right mindset again is a key. It's just to always ask yourself, what's the goal? The goal is the patient and the patient care and making things good for the patient. And whatever happens in the interaction between others, at the end of the day, it's not too relevant for the patient. And I think having that reminder is important.
It's hard. I think you're gonna inevitably, I've been in situations where like, I just don't know if there was a way to avoid a certain interaction, but I think the best thing is like, if you can like call out what happened in a sense of like, even just for yourself, like, okay, I got yelled at, what happened? Okay, maybe it was that I didn't do, like, what can you control about the situation? Because a lot of times you're not going to get the resolution from the other person. So I think learning like, you know what, maybe they didn't express themselves in a way that I wish they would have, but you know, maybe I was not organized in the morning and that's what frustrated them. I think that's something I can work on versus I can't work on their personality and how they respond to things, but you can kind of work on your own self.
Sophia,
This is
yeah, or Gracia, any of you guys have something to comment on this one?
Yeah, I have one. I feel like I was usually like a yes man, yes person in med school. Like I would just like ubiquitously say yes to everything. Like you ask me to do it, sure, whatever. And I think as that attitude as an intern can be very double-edged because you'll be seen as super helpful, but then you can also very, very easily fall into a trap where you may get taken advantage dependent upon the personalities that some of your seniors or even attendings may have. So I think for me, one of the hardest things was trying to realize like when and where I should try to like grow my spine just a little bit. And figuring out the like cordial or like the best ways that I could like eloquently say like I'm not comfortable doing that, or I don't think that's within my level of training or like within my role as an intern. You know, like especially it's busy all the time for everybody. You may be asked to go have some very difficult conversations with patients about, you know, pathophys you don't understand well enough, or even plans that you don't feel apt to speak about. And knowing that, you know, that onus shouldn't always be on you is very important. And so just figuring out, you know, how you very like efficiently and correctly say like this, I don't think this should be on me, I think has been one of the most helpful things that I've tried and still honestly trying to figure out this year.
I feel really similarly. I actually think like, I know the question was about difficult interactions with chief residents or senior residents. I actually think like if I get feedback from someone who's kind of has like they're in a bad mood or whatever, like I kind of let that slide off my back pretty easily. The thing I struggle with most is like if you have a tough interaction with someone who's like at your level, because then like how do you like, what if you're like, you know, you're trying to be friendly with everyone you know, that you work with who's like at your level, but at the same time, like maybe there's something that you really need to give feedback about. And I think I really struggle with that. I hate confrontation. And I think, and it's something I'm still working on, but learning how to not like, I think my tendency is to just bite my tongue and go home and vent about it and like take a hot shower and just, you know, deal with it my own way. But sometimes I think like Sebastian brought up, like so many people have brought up, like for the patient care, right? Like that is the objective. And sometimes, you know, I have found myself kind of saying like, I think I need to provide this feedback to someone just because like, I don't want it to happen again overnight or whatever it is. And I think like learning your style of approaching those conversations and having the situational awareness to know like how different people will react to those conversations and like knowing the appropriate time and place to do that versus the appropriate time and place to say like, this is not my place to provide this feedback. And I know that the chief resident noticed this mistake also, and someone else will take care of it. Like those dynamics, I honestly, like, I wish I had advice on like how to fix it. Like I'm still working on it, but it's things to be aware of. Because I think it's very easily to it's easy to get through the year and just kind of brush that under the rug. And then one day we'll be chief residents and we're not going to know how to handle those dynamics.
Thank you guys for all those amazing answers. Honestly, those are words of wisdom, as I told you at first, that are gonna make our life easier this year. Honestly, those experiences mean a lot. So thank you very much for your time. Dr. Buhaya, it's gonna say some words before we close the session.
Hey, everyone. First of all, thanks to all the attendees for coming tonight. I think that as someone who, first of all, my name is Minerva. I'm one of the interns at Southwestern as well, going into my PGY2. And I was in you guys' shoes, Rodrigo's and Bree's about to, and Haiti was with me at that time. And we were about to start intern year or freshly starting intern year. And this session really made a whole lot of difference. Like it eased our minds and prepared us to kind of go in with the same energy and passion, but with a little bit more answers than questions. Still a lot of questions though. I really hope that you guys got all your questions answered. And if not, please feel free to reach out to any of the panelists, myself included, even though I was not in the panel. And I encourage you to keep following LSS, the Latino Surgical Society, on their social media, visit their website. Myself, for example, I am one of the resident members. I also encourage you to become a member. And as the year progresses and as this organization and society grows, we're going to have more opportunities for residents. And I believe that there will be more events coming, for example, like behind the OR, which is actually pretty, or inside the ORs. It's actually pretty interesting. So again, thanks to all the panelists. Thank you, Rodrigo. Thank you, Ray, for moderating this session. And I hope that you guys have a great night and an awesome intern year. Have a lot of fun. It's exciting.
Thank you for the opportunity. Have a good one, guys.